What are the main findings of your study?
The main findings of the study that we did is that physicians in academic institutions, I'm sure other places also, think that radiocontrast media reactions occur more commonly in people that are shellfish allergic and or quote-unquote iodine allergic. There is no such thing as iodine allergy. That's the first misconception. And the second is that shellfish allergy predisposes you somehow to radiocontrast media reactions.
How do you think this study will affect patient care in the future?
What we did was we did an interventional study. We talked to the surgeons, internal medicine physicians, pediatricians, emergency room physicians, and radiologists, and we gave a lecture on anaphylaxis, which is also undertreated and not treated as well as it should be, as well as talked about this subject of radiocontrast media reactions. So we gave them a questionnaire to answer before they heard the lecture and after they heard the lecture, and we found that we improved the knowledge of this subject, i.e., that if you are allergic to shellfish, you're not going to necessarily have a reaction to radiocontrast media. And second is that there's no such thing as iodine allergy.
What is your take-home message for allergists and primary care physicians?
A take-home message is that iodine has nothing to do with radiocontrast media. It's a matter of osmolality, and that's what is associated with those reactions. Second is, although there may be a slightly higher incidence of reactions to radiocontrast media among patients who are atopic, in other words, have allergic rhinitis, atopic eczema, and or asthma, there is no association with shellfish allergy. Shellfish allergy is associated with proteins in the shellfish, has nothing to do with iodine. So it's a misconception.
Where do you think the research in that topic is heading in the future?
Research should be to do what we did. In other words, you have to educate physicians, because if people are being pre-treated because they're allergic to shellfish or quote-unquote iodine, you're increasing the expenses of taking care of patients whenever they go through this kind of procedure. So it's an educational program that one has to devise to get rid of these misconceptions.
Thank you.